Greetings, Dr. Daniel Helm here. I am a certified homeopathic physician, along with being a chiropractor and kinesiologist. I'm here today to talk about Nux Vomica. Nux Vomica is basically the modern day remedy for the overwhelm, overeating, oversleeping, overthinking. Again, all kind of the craziness that's going on the planet right now. And I'm finding it very, very common, especially the last 4 or 5 years, because a lot of people are having what's called a hiatal hernia, meaning their stomach gets stuck in their diaphragm. It's kind of this, oh, what are we gonna do now? What's going on now? Well, and I find 90% of my hiatal hernias are emotionally driven, which is by this remedy called Nux Vomica, again, in the homeopathic world for the overwhelm. And again, just this kind of uncertainty of what's going on. So again, irritable mind, overwhelm of the world, this kind of thing. And it could be just the body, again, going, oh, what's going on? Wait a minute. So we've got a little bit. So I'm going to test the patient today and see if we need some Nux Vomica. So what I'm going to do is I'm going to do what's called kinesiology test. I'm going to have you hold strong. So hold up strong. And again, she locks there. When I pinch here, she should go off for 1. And I'm going to take her stomach and I'm going to push it up into her diaphragm, and it goes weak. When I pull down, it stays strong. But that's very indicative of what we call a hiatal hernia. In medical community, they call it gastroenteritis reflux disease. It's not actually an overabundance of acid, it's a lack of. The diaphragmatic cavity gets tighter. Both the piriformises, the hip flexors, and the perineum, everything gets shoved up. But as mentioned, there's also an emotional component to it, kind of this, what's going to happen now? So again, right now she is testing for that. So I'm just going to put Nux on her and hold, and we're going to see, again, her body says, yep, it's more emotional than it is actually physical or physiological, I should say. So again, the overwhelm, again, whether that's too much thinking, too much stress, too much whatever, drinking, all that and more, that's our Nux Vomica. Most people are at 200 C. Now again, in classical homeopathy, especially in the UK, it's X's, and they actually are made different than in America. So most people, again, right now, a C is obviously a higher potency, and again, more for a chronic system. But again, we tend to be more of that vibration in this country, at least from what I'm finding and testing. So again, she does need a dose of 200 C. So again, 10 minutes either side of toothpaste, chewing gum, nothing strong in her mouth. We're going to put a couple pellets underneath her tongue, open, and just let her just kind of hold on to them. Again, and we're going to come back here. We're going to retest, hold. I'm going to push up here and hold, and sure enough, now she's strong. So that's our Nux Vomica, 200 C, very common for our hiatal hernias, gastroenteritis reflux disease. But in general, for everybody right now, especially for the last 4 or 5 years, all this kind of uncertainty and all this, what's going on? I find a lot of people in a Nux state. They need a Nux, usually 30 C, 200 C, somewhere in there. And then we go from there to clear them out, and then we go from there.